Hey everyone, welcome back to the Better Arizona Show. I'm Sarah Carlstrom. If your husband or boyfriend seems a little bit different lately, maybe a little less energy, a change in sex drive, it could be because of low testosterone. We have Jacqueline Olson from EnVoque MD to talk about testosterone levels, and that really seems crazy to me that men in their 30s are affected by low testosterone. Is that common?
You know, it is very common. It actually starts around age 35, and when the testosterone starts its decline, it actually affects all the other hormones in the body, male or female. And so what you'll experience with low testosterone is you'll start gaining weight, especially in the midsection. You'll start feeling like your memory's not as quick or as acute as it once was. You actually feel tired. The exhaustion starts setting in. You wake up in the morning and you just don't feel as rested. When the hormones are low, you don't sleep as well either. You know, we have male and female come in with sexual function problems as early as age 35, but certainly by 45. By the time you hit 55 and 65, there's a lot of people who are not even engaging in that way because they don't have the hormones to do so.
So when should someone come in to a place like EnVoque MD and get their blood tested?
Do you know, as early as age 30? We actually treat people in their 20s just because we are so, the onslaught of plastics and chemicals in our environment, they are finding a trend that our hormones are declining at an early age because of it.
So how do you know if you're losing testosterone? I mean, how do you test for it?
Well, it's done through blood. And when you test the levels, we actually test how much you're producing and also how much is available, because we become estrogen dominant in our society, and the estrogens come and they bind themselves to our testosterone, and it makes it as if you have none. So coming in and getting your levels checked to find out A, how much do I have, and B, how much is available for me to use is the first step.
Well, how easy is that? I mean, I can't imagine how many times you've had a client in one day know the answer to what's been going wrong with them.
I know, and that's most people are out there looking for an answer to mild depression. They just don't have energy levels. They're putting weight on and they cannot get it off, especially in the midsection. And they try all these other avenues when it's as simple as getting the hormones in balance.
Okay, so now you know the person may have low testosterone. How do you change that?
Well, then we use bioidentical hormones, which are identical to the molecules that you would have produced yourself. There's a difference between bioidentical and synthetic. The synthetic has been proven to cause very severe side effects in the body, where bioidentical, it isn't. It mimics the body's creation of its own molecules. The very first thing that we hear reported is you just feel like this fog lifts off your brain and you can think like you once did. By the time you get into your second and third week, it's when the energy levels, you wake up in the morning and you literally feel like you have this life force that just starts coming back into you.
And you talked about belly fat. Does that start to go away?
It does. By your third and fourth week, your energy levels come up, but then the belly fat starts fading off. By the time you get into your fourth and fifth weeks, you'll find that all your sexual functions come back. Your mind is very clear, very acute. Yeah.
What do your patients say to you?
It just changes the game of life for them. That's what we hear more than anything. I feel like you've changed the game of life.
Now you are offering a special for our viewers of Better Arizona, and this really is the chance, gosh, like I said, to change someone's life. Yeah. Tell me what your offer is.
Well, do you know, the very first step is, you know, because testosterone is your chief hormone, male or female. So if you start with testosterone and get the window of, am I low? Then we pretty much know that the other hormones are out of balance. So you can start with the testosterone test, and we are offering that to our first 15 callers for $99. And that also includes your initial consultation.
Well, again, that is the first 15 callers. That number is 480-582-2353, 480-582-2353. And Jacqueline, you said this affects a lot of people, 30s, 40s, 50s. It only gets worse as you get older, but it can be treated at any stage.
Yes, it can.
Wow, great news. Well, thank you for the information. Appreciate it.
You're very welcome. Thank you for coming.
Absolutely. And the Better Arizona Show will be right back.